Today we will learn about Listeria monocytogenes. In this presentation, we will discuss its characteristics as well as its pathogenic properties. We will discover how we get sick from this disease, what the symptoms are, and how long it lasts. Lastly, we mention ways to protect yourself and others from this disease. Listeriosis, the disease name for L. monocytogenes, is a gram-positive, rod-shaped bacteria that use peritracheous flagella as a means of motility, and it is facultatively anaerobic, meaning it can grow with or without oxygen. This bacteria can survive within phagocytic cells and is capable of growth at refrigeration temperatures. Listeriosis can occur anywhere in the world. High-risk individuals are pregnant women, their fetus, adults older than 65, and people with weakened immune systems. The bacterial Listeria monocytogenes can be found in contaminated food. They can be found in soft cheeses, celery, raw sprouts, cantaloupe, and ice cream. Listeria can cause a variety of symptoms when ingested. However, there are some differences in the way Listeria affects people. In mild cases, people will develop vomiting and diarrhea after 24 hours of consumption. Symptoms usually only last for 1 to 3 days. Very few people will develop an invasive illness, which is much more severe because it spreads beyond the intestines. Invasive listeriosis can cause symptoms 2 weeks after consumption. In pregnant women, fever, muscle aches, and fatigue are common symptoms that can lead to serious complications. This infection during pregnancy can cause a miscarriage, stillbirth, premature birth, or life-threatening infections to the newborn. Non-pregnant people will feel fever, muscle aches, fatigue, headache, stiff neck, confusion, loss of balance, and seizures. According to the Center for Disease Control, almost 1 in 20 non-pregnant people with invasive listeriosis die. Now that we have gone over the symptoms, complications, and period of illness, we can discuss how listeriosis is diagnosed. Listeriosis is diagnosed by laboratory testing. A sample is taken from blood, spinal fluid, or the placenta and then inoculated on a bacterial culture. A patient with intestinal listeriosis does not require antibiotics for treatment since it usually goes away on its own. However, a patient with invasive listeriosis will need antibiotic treatment. Here are some ways we can prevent Listeria monocytogenes from entering our body, especially for high-risk individuals. Avoid eating soft cheeses or make sure that the label says made with pasteurized milk. Avoid eating raw sprouts or cooked thoroughly. Eat cut melon right away or refrigerate it for no more than 7 days. This concludes our presentation on Listeria monocytogenes. My name is Stephanie S. and this video is for my Microbiology 22 class with Dr. Minu Ali. Thank you for watching.